Once you've determined the behaviour of symptoms, it's then useful to move on to the history of current condition. This involves determining when the condition started and exactly how long ago. So you will need to find out if the condition is in the early stages of pathology or moving through to a more repetitive condition, or perhaps a acute on chronic episode. Was there a problem? Was there a known cause or an unknown cause? Was the pain immediate, or was there any swelling or bruising that occurred? These are all useful factors to find out whether the swelling is continuing and indicating therefore that perhaps there is a more inflammatory type condition undergoing in the tissues. Did they undergo any immediate management? Have they put on any ice, any support bandages or whatever? Has there been any immediate management? And how have the symptoms progressed since the initial trauma or event? It's also useful to know if this was an acute on chronic condition, if there has been any previous treatment and whether it helped. The past medical history of a patient is also critical. Do they have any conditions that may be relevant to the current condition? These may be perhaps an arthritic condition which may be affecting the way that they move, or any other inflammatory problems such as psoriasis that could have an effect on the overall management of the patient. Are there any previously diagnosed conditions that may relate to the current condition, such as back pain or a leg length discrepancy? Has the patient suffered from any recent illnesses? Is their immune system been affected, for example? And are there any underlying medical conditions that may affect treatment, such as diabetes, high blood pressure, etc.? A critical component of the subjective examination is the part where you ask about special questions. These are, for example, determining whether there are any red flags. Red flags indicate serious pathology within the patient. And these are really patients that you would not go on to treat if you felt that there was pathology which was outside our scope of practice. So you need to ask about what is the general health of the patient? Have they had any recent weight loss or unexplained weight loss? Do they have a history of rheumatoid arthritis in their family, which may preclude the patient from having any cervical manipulation? What is their personal and family history? Are there any genetic components? Are they taking any medication? If so, what and how long? And particularly, have they taken any today? It's useful to know about painkillers, whether they're anti-inflammatory, whether they've taken them today, what was the dosage, and this will also help to indicate the severity of the condition. If the patient is on anticoagulants, this may also affect your treatment as it will cause bruising, readily bruising. It's also useful to find out if the patient has had any x-rays or medical imaging, if this hasn't already been done, how long ago and at which hospital, so that you can maybe find out the results of those tests if necessary. The dizziness and which indicates vertebrobasilar insufficiency, or VBI, may also be determined at this stage. This can be associated with other symptoms of the upper cervical spine, such as diplopia, nausea, ataxia, and dysarthria. There may also be a component of finding out about other neural signs and symptoms, such as pins and needles at this point. Finally, that concludes the component of the subjective assessment where you'll be speaking to the patient. But now it is worth noting down in your notes and determining in your head what is the SIN factor. And this is where you will need your clinical reasoning skills. The SIN factor stands for severity, irritability, and nature. The severity of the condition is indicated by considering the following factors: medication, how much and how often; their sleep pattern, does it wake them up; their work situation, are they at work or are they off work; and the visual analog scale score. So you may note down the severity according to high, middle or low. If their severity is high, then that will be determined by a high dosage medication, a disrupted sleep pattern, off work, and a VAS score of 7, 8 or 9 out of 10. More moderate and more low severity is obviously tapered to according to those factors. It is also worth using your clinical reasoning skills to determine their irritability. And this, as mentioned before, is determined through their easing factor and the behaviour of the symptoms. So when they have irritated their condition, how long does it take to ease afterwards? Does it take a few minutes, in which case the irritability is low? Does it take a few hours, in which case there is moderate irritability? Or does it indeed take to the end of the day, in which case it would be high irritability? Finally, you will consider the nature of the problem. As you've gathered information as you go along, you may have a good idea of what the problem is. For example, a grade 2 sprain of a lateral ligament of the ankle. But you may also be more vague if it hasn't been clear as to what the condition is. So you may just note down that it is low back pain. This will guide you with regards to what tests, special tests particularly, you will do in the objective assessment. So at the end of the subjective assessment, you will need to consider for every patient their severity, their irritability and their nature. And as a result of this, you will be guided as to how much you will then be able to push the patient in their objective examination. There is also an important fact to consider, which we have brushed upon recently, which is the red and yellow flags. The red flags are, as I said, an indication of serious pathology, and things like constant night pain, loss of appetite, unexplained weight loss, and uncontrolled fever are indications of serious medical conditions, such as cancer. Yellow flags are psychosocial factors, which, if they're not dealt with in the acute phase, may lead to chronic pain. They are, for example, things like the family situation. Are they supported? Are they trying to get compensation for a traumatic event? What is their attitude to their pain? Are they avoiding their painful movements through fear? What is their state of mind? And how emotionally stable are they? Consideration of these factors can stop a condition becoming chronic after only an acute episode. In summary, therefore, a combination of these questions should lead to a working hypothesis for the problem, as well as a direction for the physical examination. A thorough approach is imperative, no matter how simple or complex the patient seems. Missing out may mean you don't get to the bottom of the problem quickly enough. The subjective questioning technique should be done quickly and professionally, and trying to notate what the patient is telling you as you go along.